All right, so Amira, we're back. We're back live.
All
Good to
right.
see you again.
Likewise.
Now, the last time I saw you, other than this past weekend, of course, was about 4 months ago when you were one of our first guests on Tea Talk talking about cultural
Mhm.
humility. I really enjoyed it, which is the reason why we wanted you to come and speak for us at Seek. And of course, you delivered the goods there.
Thank you.
So it's nice to have you back here on Tea Talks. I'm going to have you just introduce yourself to our audience, and then we're going to talk a little bit about your talk at the Seek
Mhm.
conference this weekend and some of our key takeaways.
Well, thank you for having me again. It's always an absolute pleasure. And I was thrilled to join you all live and in person in Florida this weekend. And I'm Amira Barger. I am our Executive Vice President and Head of DEI Advisory here at Edelman, a global consulting firm. We lead with communications, and I have the pleasure of working at the intersection of strategic communications, health equity, and diversity, equity, and inclusion. And so I help to advise all the players in the health ecosystem, from medical schools to pharma to health
Mhm.
systems, even health retailers, where you go to get your pharmacy items, on the ways in which we create a patient experience that's equitable, but also an experience for our internal stakeholders, employees, volunteers, board members, all those internal stakeholders and their experience, ensuring that it is equitable, inclusive, and that they experience belonging as well. And in my spare time, I teach at Cal State East Bay. I teach communications and also change management. And occasionally I write things that get published in MSNBC and Fast Company as well.
Yes, I've been seeing those. I love when I see your post or someone posts and tags you and says, "Hey, Mira's, your MSNBC," and I'm like, "Oh, I know her. I know
Yes.
that."
Thank you for reading along.
Yeah, I know a famous person. That's wonderful. It's just, just wonderful to hear about all the things you've accomplished. And you do so with such grace and humility.
Thank you.
I had no idea Edelman did so much until you spoke, at our conference this past weekend.
Mhm.
Very, very impressed with the work you're doing there. You spoke about poverty this
Yeah.
weekend. Before we got on the call, we were talking about the high cost of living, both in your state and in my state. You're in
Mhm.
California, I'm in Florida, South Florida, and the cost of living is just crazy. And
Very
so I wanted to talk about that, about the poverty aspect of the inequities, because what we
Mhm.
we said was pile cancer on top of the cost of living.
Mhm.
It's like we have a recipe for disaster. So
Absolutely. And it's something that impacts every aspect of an individual's life, including what we talked about this weekend, health, and gaining access to care and participating in those healthy behaviors that help to prevent or intervene with whatever medical or physical issue that they are engaging with. And, we know that economic fears and realities create health
mhm.
crisis. And this year in our Edelman 2023 Trust Barometer, we did a special cut on trust in health. And the top of societal issues that our respondents named was financial insecurity and economic uncertainty. Those are issues that are keeping people from engaging in healthy behaviors that keep them healthy. Everything from a gym membership to nutritious food, right? These are all aspects that are tied to the access we have to economic prosperity. And we know that economic prosperity provides individuals access to resources that help them either avoid or to buffer exposure to health risks.
Mhm.
And research shows that individuals with higher incomes consistently experience better health outcomes than those who are low socioeconomic status or living in poverty, and affects, again, every aspect of an individual's life. And it's something that we need to raise more awareness around. And one of the things I talked about this weekend is that sometimes poverty is an insidious and silent social determinant of health, because since the 60s, poverty across groups, it has technically declined since the 60s. But when we dig deeper into those data points that are available, we see that there's still an overwhelming and a disproportionate impact on Black women and Hispanic women in their communities when it comes to rates of poverty, um, in the aggregate.
That is no joke. So on Sunday, the day after the conference,
Mhm.
I was invited to speak at a black woman breast cancer advocacy meeting. You know, it was
Mm,
their workshop, and so it literally was 99% black women in the audience, right?
wow.
And so I'm talking about some of the things from the conference that, hey, here's what we're hearing, here's what we're seeing. Not so much on the, hey, you are there's a health disparity. I didn't want to feed that line, but here's
Mhm.
some things that we can be doing. And I just felt like I was so far outside of what they could grasp, because when you talk
Mm,
about healthy eating and gym and exercise, and yes, I told them, hey, you don't have to go to the gym, you could just walk or do some chair stuff. But
correct.
one nurse practitioner came up to me afterwards and she said, she was very thankful for the information, because she said it's just so hard to get through. And was a black woman. So it's hard to get through the black women, because
Mm,
and she's seen all the deaths, right? Early deaths that were avoidable. And she said she see people discontinuing their medication.
yeah.
She see discontinuing treatment. And we talked about some of these factors, like people don't want to go to their treatments because they have to work. And the medication is expensive if it's not covered by insurance. And so, we hear about these numbers, and definitely
Mhm.
we know there might be some genomic things, but that social determinant of health, I don't think we realize how impactful it was, or it still is, on
Yes.
people's outcome. I mean, I know that my eyes have been opened this year,
Mm,
and just working with total health, and then going now into the black community, my community, and just talking from that vantage point and
mhm.
seeing the blank stares, and I'm realizing, oh my gosh, the information is light, they're light years behind the information.
Correct, correct. And we have to raise awareness around those social determinants, like you mentioned, because those social determinants, everything from how and where you're educated, your zip code, and your built environment where you live. Are there parks available or walking paths available to you? Social determinants like the way you grow up. If you grow up in poverty, you're most likely to experience it in adulthood. And so all of these social determinants that we talk about, these evolve out of systemic factors. These are
Mhm.
years long issues. And one of the things that is true is we can't eliminate health disparities until we eliminate poverty, period.
Right.
And
That's
so
that's
awareness around these issues has to be raised on what do we do systemically in terms of public advocacy and policy changes, and thinking about legislation, our elected and appointed officials to raise awareness around these issues, but then to also rally the collective around the solutions that we have to put in place, because we will continue to experience health disparities until we eliminate poverty, one of those more silent and insidious social determinants of health.
That is so true. When you mentioned the word poverty, right? What popped in my head was a speaker on Medicare expansion, and the
Mm-hmm.
shock for me when the speaker said, when they drilled into the numbers, the Medicare expansion was not impacting Black people. It was more of an impact on white people,
Mm-hmm.
which was very shocking to me, because when we hear Medicare, Medicaid, I mean, you're thinking, yeah, this is for the minority groups. They're the ones that are going to take advantage of it. And I'm
Right.
not quite sure what the reason is there, because uh, uh, you think of ACA, and you're thinking,
Mm-hmm.
well, yes, this is for those less fortunate. But the numbers, when you drill into the numbers, it didn't reflect that the underrepresented groups were benefiting from the expansion. However,
Mm-hmm.
white folks were having better results
Mm-hmm.
because of the expansion. So that's, I don't know
It's
what's going on
wild,
with that. Yeah, I don't know
right?
what's going on with
I
that.
think we have to take closer looks, and this is part of the work that my teams and I at Edelman get to do, is how are we reaching different audiences, right? Hard to reach and hard to count communities. 30% of Americans are in rural areas. How are they receiving information about the expansion? And do they understand how to tap into those resources? When you
Yeah.
think about clinics locally, are those providers sharing that information, and have they been spoken to or trained to the ways to provide more access and participation to communities that historically and with for warranted reasons, have a distrust in the medical community. I think that's part of it as well. That's why it's such a layered issue, and that's why we have to address all the social determinants of health, not just one, because like I said, there are warranted reasons for everything from the way clinical trials to medical experiments have been done that Black and Brown communities in particular have a distrust in the medical system and what they will and won't engage in terms of health behaviors. And that has to be addressed. How do we build more trust? And I was so excited at this weekend's conference where trust seemed to be, and I talked, it's an underlying theme across almost every speaker's conversation.
I agree. I have to agree. And the reason why I was so thrilled with that, because sometimes if you're not in this bubble, right, that we operate in, and you're on the outside and you say, well, these minority groups are always complaining about trust. Get over it already, right? And you may have, someone may be tempted to say that. Even minorities may be able to say, let's get over it already. But when I heard speaker after speaker after speaker after speaker, we might have had 12 speakers, and every single speaker said, we really have to deal with the trust issues. Because I honestly, I have to go actually read even deeper with this Tuskegee because what the speaker said was it went on for 40 years with the knowledge of the U.S. government, right?
Yes. So, unchecked and unbalanced.
Unchecked and unbalanced. So how do you get over that without acknowledging it up front with your audience to say, hey, we recognize this had happened, but here's what has changed since then.
Yes, so and to underscore that, not just acknowledgement that it happened, but clearly there were systems, policies, practices in place that allowed for that to happen for 4 decades.
Yeah.
And we have to unpack those policies and practices at a government level, a business level, a nonprofit level, and a community level that allowed for that to happen. And that's where these conversations around power and access and who is in the room making decisions have to happen. That's a part of health equity. It's a part of DEI, is who is in the room making those decisions and providing the perspective of what is ethical and what is right to do by communities and in terms of our practices.
Well said. Have you seen the movie Burial?
Burial? No, I have not.
Okay, so I won't give it away.
Okay.
So it's an exceptional movie. Okay. I didn't think it was going to be so good, but it is good. The reason why I brought it up, and I'm not going to give this away, but we hear a lot about get into the community and engage the church. So that's all I'm going to say. In that movie, it explored what happened there, because I'm sure, unfortunately, when a minority or a Black church watches that movie, it's going to put us way back again. Because it shows that even the church partnerships get exploited,
right?
And so it's several layers. Let me just take a couple of questions here. So what do you think the role of programs like this Weekend Seek can be to raise awareness of these problems in the community and be a force for positive change?
I love that question. I think the fact that we had so many individuals in the room from across sectors across the U.S. Is powerful, and using this as a way to disseminate more information about the medical education that Total Health is providing. That includes conversations around health equity, health disparities, diversity, equity, inclusion, and how to communicate these things. So many of the questions we got this weekend were trust, but what does that look like in practice? And we talked a little bit about, you have to find the trusted messengers in a community. So whether it's a local elected or appointed leader, a local church group, a local nonprofit group, to help be the bridge of information to those patients and the ways that they want to access medical care, the way that they want to participate and hear information communicated to them. But I think the SEEK program is helping to change the way that we do things and to raise awareness about this information. And it's free. So it's free.
Right? It's free.
We need more providers to sign up for these workshops where they're in the room with peers and with experts from other industries, talking about the challenges we're all seeing and the solutions that some of us have had success with, so that where we can scale and replicate, we do. I think, again, total health is one of the ways that we help to mitigate these disparities. This education that is free and widely available needs to be more widely known.
Yes. I'll just jump on top on that too. Peter, one of the things I wrote down, the first thing I wrote down at the conference was repetition is key, because this was our fourth, maybe fifth workshop for the year. And I've been involved in all the workshops, whether directly or indirectly, just planning it or having to review the material. And as Amira said, the theme this weekend was a lot about trust. And I've heard it before, and you can tend to become cliched or jaded, or, it's just, but it wasn't. It was not. As a matter of fact, having heard about the trust issues many times before, this weekend, for some reason, it was just more impactful for me. And so I wrote down, repetition is really key. They say marketing, get it. And Amira, you do communication. They say you have to say something 7 times or maybe even more now.
Right. For so 6 to stick is the way to say it. Take 6 to stick. You've got to hear it. Yes. And I think, to your point, why it was so impactful for me also this weekend, because we've all heard about trust between patient and provider, trust between community and institution. What was different for me this weekend is that it came with tangible examples of results, right? As people need to understand, but what does it look like? What does it feel like? How is it employed in a real world scenario? What did you actually do from step 1 to step 10 and on, so that we can think about how to implement and employ that across different communities and to scale it when and where possible. Solutions, we need specific solutions that people can ideate around.
I agree. One more thing too on the trust question. Another theme that I heard this weekend too, which was wonderful, was workforce diversity. A few speakers mentioned that you can't have equity and equality or whatever, and then you don't have workforce diversity. Right. So you can't say that you're trying to bring health equity, and then your team, your staff, there's no one on staff that looks like the people you're trying to reach. So that was very, very, that was a wonderful point being made this weekend too, because I've heard other speakers say it in the past, but again, the repetition for me this weekend was, that's right. First, we're going to look at our team. If you're in a company that's working in DEI or health equity or disparities, and you look around at the leadership team and you don't see any of those people that you're representing, there's something, wrong. I remember working in nonprofit, and the rule of thumb was, on your board, you should not just have the money givers, right, and the big influencers. You should also have a representative of your client group, of the people you're serving. Right. They should also be on the board. They may be a poverty person. It doesn't matter, because you're going to get that perspective, and you're going to be able to hear what their needs are from that board level. And I felt that was a really good message being said this weekend about the workforce diversity.
Agreed. We have to have so many different dimensions of diversity represented, because we talked a little bit about how it's a bias, and biases are neither good nor bad. They simply exist. But that bias of sameness equals safeness. And to have a physician who understands your lived experience and who perhaps looks like you can be helpful in terms of taking up or adhering to positive health behaviors.
Absolutely. And the next question you asked, Peter, was what are some examples of how initiatives like Medicare expansion have helped? I don't know if you heard our earlier comment, but my earlier comment was it has helped in terms of early detection and some other stuff, but it benefited white
individuals and patients.
People versus Black people. It did not move the needle on Black people, which was a big surprise for me, because we always associate Medicare, Medicaid, and stuff like that with the minority groups. Yet there was no change in their outcomes and their with Medicare expansion. And his last point was, we know that some of the very big healthcare injustices in this country did not happen that long ago, Do you think that trust in the medical system, especially for things like clinical trials, is improving with the younger generations?
I don't have a statistic to prove that out or point to, but I will say that more and more I see those members of the health ecosystem taking a finer tooth comb to what clinical trials look like, particularly recruitment. We actually talked a lot about that at this weekend's conference. There were several examples of how we're doing things differently in the policies and practices around clinical trials and recruitment, and taking care to speak with individuals who have historically been excluded or haven't participated, like Black and Hispanic communities in clinical trials. So I think that with a new generation, the information is more widely available. And I think the acknowledgement of past atrocities and injustices have been acknowledged by many. And there are new policies and practices across companies that conduct these clinical trials that is giving some level of or building a bridge to increased trust with newer generations of individuals and people.
So that's well said. Peter, like, Amira says, we don't have the stats because what the statistics show as of right now, one of the speakers spoke about that. As of right now, the stats show that the needle has not moved for Black engagement in clinical trial. I was very disappointed in that because I live in the bubble of total health where I hear about clinical trials all the time and I know about the disparities, but there's so much information about clinical trials. And I have met, one or a couple of women Black women who have participated in clinical trials. I thought in my mind, okay, this is good. I know about it now. I didn't know about it before. But then when the speaker, the doctor, I think it was Estela Maria, she said it did not move. I was like, what's going to make it move? My goodness. And then, I remember speaking to an advocate who's been an advocate, a Black woman advocate in the community for over 8 years.
Wow.
And she only just heard about clinical trials a couple months ago. She was blown away. And this is a woman who's representing cancer survivors and working with them and is a cancer survivor herself. But at no point on her journey and in her conversations, clinical trial was presented to her. So I realized we have a really high mountain to climb with that.
Correct.
And it's going to take so much more than lip service. It's going to take diversifying the workforce so people can actually trust you. It's going to take doctors. Some of the doctors were very honest this weekend. They said, they have biases. And we all do. And we all do. And we need to just recognize that we have these biases. That's why we're not offering these things to these minority groups.
Right. We have to recognize those biases so we can mitigate them. And, that's part of the work that my teams and I get to do is from a communications perspective, how do we reach those hard to count and hard to reach communities who have been historically excluded, and partnering with, again, every company in the health ecosystem, every institution you can imagine, to help them think differently about their policies and practices to ensure we do move the needle.
That's right. We're going to leave you with a last word. So, other than yourself, who gave us all that great information on the poverty, what was another? What's one big key takeaway? We talk about the trust. The trust thing was a big thing that was really, really interesting for me too. What was another key takeaway that you got from this weekend that you want to leave our leaders with, leave our audience with? That's hopeful. It's tea talk. Yeah.
That's helpful. Dr. Aluwalia and several others talked about survivorship quite a bit. And they talked about the families and the relationships that surround the patients that we have the pleasure of working with and serving. And to me, that is an important and poignant takeaway, because those are individuals who become advocates and who become seeds of information that is spread, whether it's about clinical trials, whether it's about bias in medicine, whether it's about trust in patient-provider relationship, whether it's about the process of when you get a diagnosis, what do you then do? How do you navigate the system? And I think those family members, those survivors, those individuals who surround a patient, having access to more information and helping to spread that, it's just continues to ensure that the collective is aware of how we get away from these health disparities and mitigate them so that there is more equity in every aspect of care, from adopting positive behaviors to engaging in clinical trials to knowing and understanding the kinds of questions you can and should ask your physician as you determine together as partners what your care looks like. And I think that's a component of how we continue to mitigate these disparities, is to think about those who surround the patient as well, and what access to information and participation are we providing them too.
Wow, and that's a big ask for some doctors who are not even working with
Right.
patients to bring to to include the community, the patient's community.
Right.
That's really key. And we heard about just culturally how, like one doctor shared, the woman says, I have to speak to my husband, I have to speak to somebody. I can't make, or my daughter, I can't make this decision by myself. And it goes back to that biases again. If a doctor is used to, let's say, a member of another race who can make that quick decision, right? And then this other race is like, I can't make a decision. You have to really address your biases, right? Because you're making a judgment right there, like, really? But it's just culturally how things are. So I'll end with what Peter asked before about the importance of having a program like Seek. Peter, I actually did a closing video on that. Amira really, said it best when she said, we need programs like Seek. We need people to know more about programs like Seek. We need all physicians involved in Seek. We need them to come and network with their peers and get best practice ideas. But most of all, we need sponsorship for Seek, because it's a free program to attendees and to physicians, but it's not free to us who has to pay for it. So it goes back to that bigger question: why isn't more investment being done in this area? I can't answer that question. But if there were stakeholders who really believed in this, I don't think we'd be struggling with getting sponsorship for this amazing program that would actually, impact, save lives, and make a difference to that next generation you're asking about. So, Amira, thank you so much for popping back on here again and just giving us your feedback. Always great to have you. And Peter, thank you for holding down the fort in the comments.
Thank you, Peter.
Always faithful. And anyone in the replay, well, you can contact Amira directly.
Absolutely.
All right, guys. Yep. Take care, and we'll see you. Or Peter will be back on Tea Talk himself, interviewing a couple of doctors this week. So stay tuned.
Cheers.
Take care. Bye.